Let's go ahead and move on to item 6.5, our 9:40 a.m. item, consideration of presentation from Lake County Behavioral Health Services staff on National Prevention Week, May 9th through 15th, 2021, activities as well as highlight the work done year-round to support prevention of behavioral health challenges and needs in our community. Director Metcalf. Good
yes,
morning.
thank you, Mr. Chair. I'm actually going to turn this over to our Mental Health Services Act team leader, Carrie Manning, who's much better versed in this than I am. So Carrie, I see you're on. Take it away.
So good morning. I'm going to share my screen so that I can show you the amazing presentation that me and my staff worked on. Just let me find the right one. Oh, I think I got them backwards.
This is what I brought you.
Let me try that again. Sorry.
No worries at all.
Okay, there we go. Got it right. Good morning, everybody. My name is Carrie Manning, and I am the MHSA team lead for Lake County Behavioral Health Services Department. I supervise the 4 peer support centers and our prevention team. Today's presentation is in celebration of National Prevention Week, which is May 9th through the 15th. And let's see, it is a public education platform that promotes prevention year-round through providing ideas, capacity building, tools, and resources to help individuals and communities make substance use prevention happen every day. National Prevention Week culminates in May, recognizing the important work that has been done in communities throughout the year to inspire action and prevent substance use and mental health disorders. And prevention is defined as the action of stopping something from happening or arising. And our vision statement is to improve the quality of life for the people of Lake County experiencing mental health illness or substance use disorders by offering recovery-oriented services. And I'd like to recognize the team that assists our department in improving the quality of life for our communities. We have our prevention specialists, Kendra Boyce and Michael Moss. They have provided both substance use prevention and mental health awareness, suicide prevention services to the entire county. And our peer support center teams are David Abels, Edgar Ontiveros, Ana Tena, Jorge Morales, Melissa Farrell, Tony DeLange, Thomas Brown, and Patricia Santa Cruz. And we have a new staff starting, Elizabeth Arnold, next week. They are always willing to help their fellow community members during COVID. They have assisted with Project Room Key and the vaccination clinics, and they have also assisted in the pit count, the point in time count, and their determination and desire to have a positive impact on the community is very appreciated by everyone at LCBHS at Lake County Behavioral Health Services. And this, based on Robert Wood Johnson health rankings, Lake County ranks 58th out of 58 counties in the state of California. For just our department to start to create change in our community would almost be impossible if we tried to do it alone. And so these are just a few of the wonderful community agencies that we have partnered with, and some of the community events that we participate in. And I know I haven't gotten everybody on here. This is just a screenshot of what we do. And we're lucky to not be in this alone, because by pooling our resources together and sharing ideas and data, we can effectively provide the services to more of our community. And so our youth substance abuse prevention program mainly involves education in the schoolroom. For the middle schools, we use Project Alert. It is an evidence-based program. And, you know, it helps our youth to understand the consequences of using drugs, develop reasons not to, understand the benefits of being drug-free, and also recognizing that most people don't use drugs. And we also, you know, help to increase their self-esteem, which, you know, limits the use. And then for the high schools, we use The Truth About Drugs. It is also an evidence-based program. And they do the same things. There's 14 truths about drugs. They go over the most commonly used. And again, you know, they educate on the effects. They educate on how to say no. And also, again, that most people are not using, which is, you know, a myth that a lot of our youth believe is that, well, everybody's doing it, when in all actuality, they are not. We also have the Partnership for Success state grant for opioid misuse and abuse prevention. And that has involved classroom education, parent education, school and community events. We collaborate with Lake County SafeRx. And then also we are going to be beginning implementation of the OD map, which will allow agencies to see where overdoses may be spiking in the community so that we can provide extra outreach and services to those communities. And then this year, our Partners in Opioid Prevention Summit will be on June 16th. And this year, we're really excited. We're going to have Tony Hoffman be the key presenter. And he will be sharing his experiences with opiates and how he overcame his addiction from opiates and homelessness to coaching in the Olympics. The summit is open to all of Lake and surrounding counties. And I really encourage everybody that can attend. There will be a registration link on our website and also on our Facebook groups and pages. And so in the prevention services, peer support workers are people who have been successful in their recovery process, who help others experiencing similar situations through shared understanding, respect, and mutual empowerment. Peer support workers help people become and stay engaged in the recovery process and reduce the likelihood of relapse. And peer support services can effectively extend the reach of treatment beyond the clinical setting into the everyday environment of those seeking a successful, sustained recovery process. Our peer support centers are like the entry into many different services in the community. These are some of the groups and services that we offer. There's a survival cooking class where we actually teach people how to make meals with what they get from the food banks and different distributions. We have support groups in Spanish and English. We offer parent groups. We've had a youth-led peer support group, talking circles, life skills, art groups. Art really brings people together. Other things that they offer are advocating for people that are utilizing our services. They are a wealth of information on resources and how to link people to the services that they might need. And then, you know, they also offer self-help groups and other groups to help improve their lives. So the Big Oak Center is located in Clear Lake Oaks, and you'll see here some pictures. We do the shower trailer there and food giveaways. The primary focus of the center is severely mentally ill community members, as well as those that are unhoused. David Abels is the lead at the Big Oak Center, and he has worked hard collaborating with numerous agencies in the community. He wants to make sure that every person that enters that building walks out with a smile and a need met. And he does a great job at that. There will be a Mental Health Matters Month event at the Big Oak Center on May 18th from 10 a.m. to noon. And that is also the day that we partner with Adventist Health for the pop-up care shower event. And the pop-up care and shower takes place on Tuesdays from 11 to 3. There are other agencies there that can help people apply for services that they might need with housing or health insurance. And we have the Circle of Native Minds, which is located in Lakeport. Oh, and I forgot to mention, I wanted to mention that we've served in 1920, I should say 2019 to 2020, we served 420 unique community members, and we provided over 27,000 services to those community members. And that could be, referrals to different agencies, food, clothing, shower, whatever they needed. And considering that there's only, there's limited staff at the centers, that's amazing. And also that we had COVID. That was a factor in providing services during that time period. So the Circle of Native Minds is located in Lakeport. Thomas Brown is the lead staff, and he provides outreach services to the Native American community by visiting the reservations, sharing the history of the Pomo culture to promote healing. Patricia Santa Cruz is also working there, and the center provides a variety of groups and support services, and it is open to everyone in the community. Thomas does provide different cultural activities as well at the center and outside of the center. And there will be an event to celebrate Mental Health Matters Month on May 14th from 10 a.m. to noon. And all of these dates and times are on our Facebook groups and I believe our website. And then we have the family support and Thomas served 189 unique community members and provided over 7,800 services to the community. Family Support Center is located in Middletown. Their main goal is to help parents that could be struggling with their children, grandparents raising children, aunts, uncles, anybody raising, kids, and helping them, guide them through the system, as well as improving their mental wellness. And so in February of 2020 is when we opened, and then March of 2020 is when we shut down. So they've had some struggles. I'd like to encourage all the community to contact Melissa. If you're interested in the Parent Cafe or any of the other groups that we are doing, they also have a learning hub there. And we are working with Lake Helping Hand to provide a food distribution site, as well as Adventist Health to provide the shower trailer pop-up care event. And they will be having several activities over the month. The main one being on May 21st from 12 to 3 will be the main Mental Health Matters event. But check out their Facebook group. They have some great activities planned each week. Then we have Lavos and Melissa, and that center served 63 unique community members and provided 133 services. And Lavos is our Spanish-speaking Latinx community center, also open to everyone in the community. They do have the food giveaway there monthly. as well as they are working with Lake Adventist Health to provide a shower trailer pop-up care there as well. And we recently moved the center. It is at 14092 Lakeshore Drive in Clear Lake. They also do some art groups, Latina support groups. They have Spanish AA meetings there, I think 3 to 4 days a week. And Edgar and his team, work very hard at providing services for the Spanish-speaking population as well as other people in the community. And they provided services to 648 individuals and provided them with over 46,000 services. The Harbor on Main is our transitional age youth center. We contract with Redwood Community Services so that we can provide youth with a safe place to go. They can do homework there, get help with that. They have free resources, clothing, hygiene products, computer, life skill groups. I know that they've helped kids find jobs. It's an amazing center. I went in there the other day. They've got pool tables and it's just a very friendly environment. And they served 174 unique community members and provided over 13,000 services and 1,200 visits. I encourage everybody to check out all of the Facebook groups and to see what they're doing at their centers. So then we also have our suicide prevention and awareness education programs. I'm almost done. Mental health and well-being are fundamental to our collective and individual ability as humans to think, emote, interact with each other, and earn a living and enjoy life. That is from the World Health Organization. And the Suicide Prevention and Awareness Coalition, we are currently working with Each Mind Matters on implementing the Striving for Zero campaign, which is a suicide prevention program to reduce completed suicides and provide education to the community. Part of this campaign will be to reestablish the Life is Sacred Alliance Suicide Prevention Awareness Coalition. All community members are invited to participate. Please contact myself, Kendra Boyce, or Michael Moss, whose our contact information will be coming up for more information. Lake County is ranked the highest per capita in completed suicides. And, our goal is to reduce that and, strive for zero. And we have some really good programs that work towards that goal. First, we have our mental health first aid training for people who work with adults, with youth. And then we also have the exciting teen program, which we started to implement right before the shelter in place happened and are currently, working on bringing that back to the schools. That is a program that teaches youth how to support each other. And the main goal is teaching them that it is okay to not be okay and how to seek help for themselves or their friends. And then we also offer the adult and the youth mental health first aid that teaches us the same, how to talk to others about suicide and that, it's not the S word. And how important it is to be able to ask someone those important questions, how to respond to them, and how to get them some help. And then we also have 2 shorter courses that are Know the Signs and Question, Persuade, and Refer. These are both great trainings, just kind of like an entry level, how to talk to someone. What are the warning signs? What do you do if you, see the warning signs? How do you approach that person? So please look on our Lake County Behavioral Health Services website or the Lake County Prevention Facebook page for links to all of these trainings. If you or an organization would want a training for a group of people, please contact one of us and we will get that set up. And during the 2019 to 2020, we had 154 people that were trained in one of those programs. And we would like to see that increase even more. And 91 of those were school-age children or youth between the ages of 16 to 25. We do offer the QPR training and know the signs to our youth, as well as the teen mental health first aid program. And in conclusion, this is our contact information. And then, just some quick, if you are experiencing some mental health challenges or just need somebody to talk to, you can call any one of these numbers. There's also a text line, 741-741, just text help and someone will contact you back. So I tested that number out because I was like, oh my gosh, texting, and they do respond very quickly. So with that, I am going to stop sharing my screen and I'm done and I'm open for any questions.
Thank you very much for your presentation. I just want to make sure and reopen it up for Director Metcalf in case he has anything to add before we go to the supervisors.
No, actually, that's a tough act to follow. I know that was a lot of information. We tried to keep it under 15 minutes, but just wanting to share, because this is Mental Health Awareness Month and this is Prevention Week, we thought it would be timely to share, some of the programs and services that we offer. When I took over this position a little over 4 years ago, I didn't realize that we did so much. And so I thought it was time to have staff share what we're doing at our peer support centers and all of the other things we're doing around prevention on multiple fronts in our department. So I appreciate your time and thank you and thank you, Carrie, for the presentation.
Okay, thank you very much. Any comments or questions from the board? Supervisor Scott?
Just want to thank Carrie for her presentation and bringing this awareness to our community. Behavioral health does some amazing work, and so thank you for sharing all the programs that you have there. And also just to highlight the classes that you talked about, they're free to the community to sign up. So you never will know when you can use that information to help a family member or a community member. I've actually taken the class and it was just good information to have. So I encourage everybody to sign up and take one of those classes.
Thank you very much for the comments. Any other comments? Supervisor Crandall?
Yes, thank you for the presentation, and just wanted to state that I appreciate seeing the different variations of services and support services for different ethnicities and whatnot, but we all do get addicted the same. We all respond the same to these, if we're addicted, we respond to the substance the same, but we all end up in this very similar situations. We have family that's affected by these type of things. And it's very imperative that we ensure to prevent suicide and all of the other measures that you put forward. And so I just wanted to thank you again.
I did have a question, and I'm not sure if that would be Carrie or Todd that would be able to respond. Seeing the numbers of services and unique individuals that are helped by each facility, I see that Lavos has a very large unique member count and services. How far-reaching is Lavos? I know it's in Clear Lake, and obviously there's quite the population that surrounds it, but do they see community members from throughout the lake, or is there a need in the future to look at possibly duplicating that service somewhere else in Lake County? Because I know that there's very large pockets Latinx community members in the Kelseyville area and other places as well. Just want to make sure that they have that level of access to this facility.
Thank you. I know that they are very busy, and I think it's because they have been here in Clear Lake since we started the peer support centers, and there is a need elsewhere in the county. Patricia Santa Cruz at the Circle of Native Minds is Spanish speaking. She is Latinx from that community. And so, we're trying to increase the reach by having bilingual staff at the different centers. And we are also in the midst of a very exciting project. Our outreach van is going to hit the streets hopefully within the next couple of months. We still have some work to do, and the staff that are going to be on the outreach van, our outreach is primarily going to be to the homeless community and youth that are unhoused. But we're there for the whole community, and staff from the different peer support centers and our prevention specialists will be on the van, and we'll be able to if needed, transport them to a medical appointment or the emergency room or to Labos or one of the other centers. I feel like, while there is that great need throughout the whole community, I think that we are reaching, that the Hispanic, Spanish-speaking population by being able to connect with Labos. And having Spanish speakers at the different sites.
Awesome. Thank you very much for that update. I think that obviously you know better than I do, behavioral health is becoming more and more an important conversation we're having, not just as a nation, but in the state as well. Even as we slowly see ourselves out of the pandemic right now, there's still many goals being set to enhance behavioral health services in our communities. The conversation that's happening nationally with law enforcement has a lot to do with behavioral health opportunities as well. By closing some of our facilities in the past, has put that burden on top of our law enforcement. How do we retackle that situation to bring a better balance in our communities? So I think that we're going to see a bigger summary in the upcoming years versus what you're proposing today and offering today. And so I look forward to what those changes are, because I know that the state is not done providing some funding to make those things happen in our community, and I look forward to implementing those.
Right, and I forgot to mention that we are working with the Sheriff's Department and the local police departments on providing the adult mental health first aid training to as many of their staff as we can.
Thank you for adding that. Supervisor Pyska?
I just want to applaud your innovation and going out and developing all these programs and the creating the opportunities for cultural access, and now with the mobility van. Mental health is really about the whole person care, and you're doing an excellent job, and I really applaud everybody in your department and all of the work that you're doing.
Thank you.
Yes, thank you.
Any further comment before I open up? Supervisor Simon?
Obviously, follow right along with the rest of the board, just the great work that's being done. But I do have one question, and what we've learned, obviously, and I know it's increased in this time, is Zoom appointments and other things. I know that sometimes the outreach, we have the phone numbers here and other things, but in the future, will there be an opportunity for folks to do Zoom intervention lines and other stuff like that? So I have that question going forward with what we've learned during this pandemic, that it helps not only just to be talking, but sometimes seeing a face and seeing those emotions and understanding somebody. So I just wonder, it's great everything we have here, but if that is something being considered by you guys.
Well, we have actually already I think all of our peer support centers are doing some type of Facebook room group daily. I know at the Big Oak Peer Support Center, he has been doing coffee chat every morning at 9 o'clock. I think we have some issues with Facebook right now, but hopefully we're going to get those resolved so that we can start that again. And then we have the Parent Cafe. So we are utilizing, Zoom as well as Facebook rooms to be able to provide that virtual support. And then currently we are installing smart boards at each one of our centers so that we can provide even more virtual support and we can move into a hybrid model, for those people who feel more comfortable watching on Zoom or participating in a Facebook group or, just being able to have that one-on-one, at least face contact with somebody, if not in person. So, and I have to really applaud our staff because, a lot of our staff haven't been using computers, and so they've had to really learn how to integrate the virtual services in with the in-person style of providing services. And they've done an amazing job.
And just to add to that, we've been having conversations at the management level in our department with restrictions, COVID-19 restrictions being loosened up, that we're trying to address how we can get back to more in-person services. So we're absolutely having those conversations because I feel like during the pandemic, although I've said that maybe some of our no-show rates went down because it was easier for folks to engage via telehealth, I'm sure we've been missing folks that weren't able to access, via internet or even cell phone. And so, yes, we're absolutely taking a cautious approach to getting back to more in-person services.
Well, I guess my comment is always everything we've learned, just having every option because everyone is different in how they're going to approach it. So going forward, that even as the things lifted or unrestricted, that we keep that other option out there because that might be the one lifeline that gives someone an opportunity. So that's just my only comment.
Oh, absolutely. I mean, this has been a game changer. And if we can do both, as Carrie mentioned, this hybrid model, I think we'll have even more success in reaching more folks.
Mm-hmm.
Thank you very much. If there's no further comment, let's go ahead and open it up to the public for any comments or questions. I see none here in the boardroom. If you're in the Zoom room, please press the button at the bottom of your screen to raise your hand or dial *9 if you are in via telephone. And seeing none, we'll go ahead and bring it back. And thank you for your presentation today and updating us as well as the public on all the services that are available through behavioral health. And keep up the good work.
And thank you for the opportunity.
Yes, thank you. And we have more services than this, so stay tuned.
Yes.
Yes. Thank you.